Hello, my name is Irene Lares, and I'm the Neuroscience Vice President here at DHR Health. We want to thank you for the opportunity to share more about careers in neurosciences and different opportunities. Neuroscience is really focused on brain health and disorders of the brain, nervous system, and spine. And as you can imagine, the brain is very complex. It's really how we interact with the world around us. So as you can imagine, there are very many specialties and subspecialties that are involved in neurosciences. So on the next slide, we're going to go over some of those specialties. So as you can see, there are specialties within neurosurgery. So there are neurosurgeons who can focus on epilepsy, stroke, spine, and even pediatrics. There are a multitude of different specialties in neurosurgery. You also have interventional surgery, which is advanced surgery that is less invasive. So you have neuroendovascular surgery, where they can focus on stroke as well as trauma in a less invasive form. Within neurology, you have epilepsy, you can have stroke specialists, you can also have neuroimmunologists. There's a wide variety of different specialties that are available in neurology, even movement disorders like Parkinson's and pediatrics, as well as other specialties. Within neuroscience, you also have physical medicine and rehabilitation, which focuses on the rehab needs of patients who have neurological disorders. Within these areas, you also have different specialties that focus on supporting neuroscience patients. We also work very closely with research, education, and the quality department. Within my role as Vice President of Neurosciences, I have a unique role to bridge together both clinicians as well as the financial aspects of strategic planning for centers of excellence and quality within the service line. In my role, I began as a bedside nurse, and I was a nurse in Neurocritical Care services for about 4 years. I then went on in a more administrative role, and I was able to pursue my master's degree in nursing administration. As the vice president, I have a unique role to be able to work with clinicians and multidisciplinary team members. Without multidisciplinary team members, we would not be able to provide the care to this unique population. So we also work with paramedics in the pre-hospital setting that bring in patients into the hospital. We also work with the emergency department as well as radiology. So radiology is essential for being able to diagnose disorders of the brain and spine. There are also careers that are available within neurosciences that are more supportive, like physical therapy, occupational therapy, and speech. We also have case managers and social workers available in neuroscience service line. So we welcome you to be able to learn about all these different roles and the need for these patients. So today we're going to focus on our stroke service line, and we're going to pass it on to Anissa Garza, who is one of our stroke coordinators.
Hi everyone, my name is Anissa Garza. I am the stroke coordinator here at DHR Health as part of the Neuroscience Institute. I have been a registered nurse for about 6 years. I have experience in cardiology, in rehabilitation nursing, and now neurology. My role here at DHR Health is to ensure that we maintain our stroke program. My role also is to provide education to our patients, to our community, to our staff. I analyze a lot of stroke data and I present that to a lot of our leadership. I also help to develop policies and procedures in regard to stroke care, and I also respond to stroke alerts in the emergency department. So as soon as a stroke patient comes into the hospital, I'm there to make sure that everyone's doing what they need to do and doing it safely and fast. So our goal is to provide safe and effective care for our patients to make sure that they are able to go back to their daily lifestyles. So here at DHR Health, we are a comprehensive stroke center. There are many career paths in our neurosciences, and our comprehensive stroke center is one of them. So we provide very crucial treatments to our stroke patients, and so we have different services that we provide. So on the next slide, we have our Joint Commission. So our Joint Commission, we are Joint Commission certified by our Comprehensive Stroke Center. And so Joint Commission is one of the more prestigious accreditation companies in healthcare organizations, and so it is a very prestigious award. And so we also get awards through the American Heart and Stroke Associations. So we have dedicated care. So we have our neurology services, our endovascular services, and our neurosurgery services available 24/7, any time of the day or night. So whether a patient's having a mild stroke or a very severe stroke, we have the capabilities to treat those stroke patients any time of the day or night. So we are the first in the Rio Grande Valley to fully integrate all of our neurology services, neurocritical care, neurorehabilitation, to benefit our patients. So we do have our neurointerventional radiologists, our neurologists, we do have a neurohospitalist as well, we have a pediatric and adult neurosurgeon, we have our neurosurgeons, our physical rehabilitation physicians, and our clinical neuropsychologists. So what is a stroke? Stroke is the leading cause of disability and the 5th leading cause of death in the United States. Each year, approximately 795,000 Americans will have a stroke. Every 40 seconds, someone has a stroke. So stroke is a type of brain attack. It occurs when blood vessels that carry oxygen and nutrients to the brain is either blocked by a clot, which is an ischemic stroke, which makes up about 87% of our patients, or when a blood vessel ruptures in the brain, causing a bleed in the brain, which is about 13% of our patients that come in. So the consequences of these strokes can be disabling and can sometimes even lead to death. So it's really important that we know the different types of stroke and the different types of treatments. So there are various roles that our nurses, our staff play in taking care of these patients. So recognizing a stroke. So you yourself can be an advocate for people out in the community, a friend, a family member. So recognizing the signs and symptoms of a stroke, you can actually be able to provide the fastest treatment for them and getting them to the hospital. So you can think of the FAST acronym. So the F stands for facial weakness or asymmetry, a droopy or uneven smile. A stands for arm or leg weakness or numbness, especially on one side of the body. S stands for speech, so they could have slurred speech, trouble speaking, trouble understanding, even sometimes repeating a simple phrase back to you. And of course, T stands for time. Time is of the essence. Stroke is an emergency and we have to act very fast. So as soon as these signs of a stroke are recognized, we have to communicate with 911. Get that person to the hospital as soon as possible and be aware of when that person was last seen normal or when those symptoms started. It's very important that we know that time so that we were able to provide the treatment that they need as soon as they get to the hospital. So knowing the risk factors of stroke, you have the chance to change your lifestyle and prevent a stroke. So factors that you can change: if you have high blood pressure, if you smoke, if you have high cholesterol, watching your diet, physical activity, making sure that we monitor our blood sugar levels if we have diabetes, and of course our weight. So staying physically active, taking care of our heart to take care of our brains. The factors that we can't control though, of course, are our age, our race, our gender, family history, or if someone has a past history of a heart attack or a stroke. So the things that we can try to control, that's what we want to do to get our hearts healthy and our brains healthy. So again, time is brain. Stroke is an emergency. We have to make sure that when the patient gets to the hospital, we have to act really fast. We have to call what's called a stroke alert within 5 minutes of that person getting to the hospital. We have to have the doctor assess them within about 10 minutes. We'll have our stroke team there within 10 minutes. We're going to get them to the CT scanner. That CT scanner is going to show whether they have a clot in the brain or whether they have a bleed in the brain. We'll draw some labs, and then hopefully if they have a clot in the brain, we can give them a medication called Alteplase. And hopefully that medication will be able to break down that clot in the brain. If they can get that clot busting medication, but they have a really big clot in their brain, they have a really big blood clot in their brain, we actually have the capability to go up into the brain and extract that clot directly from the brain. So we have about 30 to 45 minutes to give that clot busting medication, and then we have 90 minutes to get them to that procedure. If they have a bleed in the brain, then we have about 2 hours to get them to the neuro OR suite. So immediate response is crucial. Every minute matters. We do have treatment options available. So within the first 4.5 hours of symptom onset, we can give that clot busting medication. If they're outside that window of time, then we are able to do what's called a thrombectomy. So as you can see, that TPA is going to break down that clot in the brain. But if it's a really big clot, they can get TPA and also get that endovascular procedure, where they can put a stent directly on the clot and extract it. DHR is the first Joint Commission certified advanced comprehensive stroke center in Hidalgo County that performs neurointerventions for stroke symptoms within 24 hours of symptom onset. So the CT perfusion studies are going to show whether the patient has a really big clot in the brain. So as you can see in this slide, that little red dot is where the stroke is actually happening. That's already brain tissue that will never be able to be regenerated or come back. But you can see in the green area highlighted, that's how much brain tissue we could potentially save. If this patient goes untreated, we aren't able to give that clot busting medication or go for that thrombectomy, then that's how much brain could potentially be lost, of course resulting in lifelong disability and or even death. So these CT scans of the brain are able to be sent directly to our cell phones. We can look at these CT scans and know exactly whether that patient has a clot in the brain and whether we need to make sure that we get our team right here and ready to go so we can take them for a procedure. So this is a type of demonstration for when they have to go in for a thrombectomy. So what they'll do is they'll puncture a small artery in the groin and they will insert a catheter all the way up into the heart. Instead of stopping at the heart, they're going to go up into one of the major arteries of the brain, and they're going to also insert a stent into that catheter. They're going to insert that stent directly on the clot. They could even inject a small amount of that clot busting medication right on the clot. How cool is that? So once they actually put that stent directly on the clot, they're going to aspirate it out, or they're going to suck it out of that artery, and then you can actually see it right there in the palm of your hand when you take out that clot. So that's actually really cool. So in the actual procedure, what they do is they inject contrast or dye right up into the brain. So as you can see on the left-hand side of the screen, that there is a clot there. Where that arrow is pointing is actually where that clot is located. You can see how much blood is being cut off to that side of the brain. In the middle picture, you can see where that stent is actually right on that clot. And on the right-hand side of the screen, you can see when they actually extract that clot, how much of that blood is being restored back into the brain, and hopefully restoring some of that blood tissue and hopefully not leading to any long-term disability. So in this next slide, we have an example of a stroke patient that came in. They weren't able to talk, they weren't able to move their extremities, and once we took out these clots, they were actually instantaneously able to start speaking again and start moving their limbs little by little. So you definitely don't want to live with this clot in your brain. You can definitely live with these disabilities for the rest of your life if this clot is not extracted. So if in case a patient comes in and they have a bleed in their brain and it's caused by an aneurysm that has ruptured, what we can do is actually go in and clip that aneurysm and sew that aneurysm, that vessel of the aneurysm back up. If there's an aneurysm that hasn't burst yet, then we can actually go in and do a procedure called coiling. So what they can do is they can insert this coil right up into the aneurysm so that way the blood isn't gushing into that aneurysm and it prevents it from bursting, causing a bleed in the brain. So we do have dedicated stroke care. Our Neuroscience intensive care unit is the unit that all of our stroke patients will usually go to. We also have a dedicated Neuroscience step-down unit, and we also have a board-certified neurointensive care medical director. We have ischemic stroke and hemorrhagic stroke minimally invasive surgeries, and we are also DHR Health Rehabilitation CARF accredited, so we are the only rehab to have our exoskeleton in our rehabilitation unit. We do have a dedicated stroke research team as well that will be able to go and visit patients after they have their stroke, and they will be able to go and visit them in their home and make sure that they don't come back for another stroke. So it is a multidisciplinary approach. Here's a picture of some of our team. Some of our EMTs and paramedics are our frontline workers. They are the ones who bring in our stroke patients. They see the patients first, and they're actually able to let us know what they're bringing in, what kind of stroke are we looking at. We can prepare our team in plenty of time and make sure that we have everything we need in order to take care of this stroke patient before they even come in. We have all of our administrators who make very important decisions and clinical decisions to ensure that there's certain procedures and policies in place that we take care of our patients in a cohesive way. We have, of course, our nurses who can be certified in neuroscience, in stroke, and even in rehab. We have various amounts of doctors, including neurology and cardiology. We have our certified nurse assistants. We have laboratory technicians, radiologists, and radiology techs. We have pharmacists, of course, our therapists, our occupational therapists, our speech therapists, and our physical therapists. We also have our rehab physiatrists, dietitians, case managers. So there's a lot of people that go into taking care of a stroke patient. And so it's really important that we know what kind of options do we have. Are we interested in neurology? Are we interested in the neurosciences? There's a wide variety of opportunities for you to take in this field. And of course, you have to be passionate. You have to love what you do. Of course, one of the things that I love about being a stroke coordinator is that I can actually go out into the community and provide education. So we work very, very closely with our EMS providers. We attend various health fairs and health, we attend various health presentations out in the community to certain populations that are more at risk for a stroke. So we also work very closely with other stroke coordinators in the Valley, and so we will film commercials, we'll post billboards all over the Valley so that way people can recognize the signs and symptoms in stroke, call 911 as soon as they can, and get to the hospital. So you can be a stroke hero. You, of course, play a big role out in the community as well by recognizing the signs and symptoms of stroke, recognizing the risk factors, helping people to prevent them from having a stroke. We can call 911, but then, of course, if later on in life you've experienced a stroke, who's going to take care of you? Of course, the hospital is. So if you're interested in the neurosciences, we would love to have you. Thank you so much for your time, and hope you guys have a great rest of your day.